Good evening, Los Angeles. I hope you and your families are safe and well. 95 times I've come before you to give you life-saving information during this pandemic, to reassure you, to mourn with you, to mobilize the spirit of our city to face the greatest challenge that our town has ever seen, and to get through the past 16 months as we fought COVID-19. We've made so much progress, and that's why you haven't heard from me for a while. But I said I would return to brief you if there was information that you needed to know, something important to share. So I'm here tonight for a 96th time. I'm joined by our City Council President, Nury Martinez, because this is one of those moments. To put it bluntly, we are facing a surge of COVID-19 here in Los Angeles once again. Our cases are up, our test positivity is up, our hospitals are admitting a growing number of our friends, our neighbors, and our family members. So we have to act again to save lives, to do the necessary work that I have witnessed. I trust you and I believe in you because I've seen you act over these last 16 months to take heroic actions that save the lives of the people that we love. And I know that you can summon that brilliance, that determination to once again do the same. I want to be clear. The number of cases that we face is not as high as the surge in the winter. On Friday, though, we had more than 3,000 new cases here in LA County. The last time that happened was February. In just 1 month, we've seen our total cases more than triple from June. And our incredible vaccination work this spring helped us flatten the curve and then push it down by 99% at our lowest. But as fewer people get vaccinated, and as the world waits to be vaccinated in large numbers, the Delta variant has spread. Now the dominant variant here, making itself at home in our city. It's highly contagious. It spreads about twice as easily as the original virus, and now accounts for the overwhelming majority of cases here in LA County. The surge is not just happening here. This country and the world is experiencing a fourth wave of COVID. Our country has seen a fourfold increase in new cases per day over just the last month alone. And this variant is spreading throughout the world, filling hospitals and spreading suffering and loss once again. We're facing a real threat, and the only way we'll gain the upper hand is by fighting back. The good news, so different than almost every other time at a briefing, is that we have a vaccine. We have a safe and effective vaccine, something unthinkable a year ago, and it couldn't be easier for you to get. And if you have any doubt whether it offers you protection, consider this. Right now, over 90% of the people who are currently hospitalized with COVID, over 90% are unvaccinated. And more than 97% of the people dying from COVID are unvaccinated. As I've said many times before, you'll either get the vaccine or COVID, and I'll tell you which one of those can kill you. Tonight, I'll talk to you about what you can do to help us turn this tide, and share with you what your city is doing to help support you every step of the way, to continue this road to recovery, which you fought so hard for, and which we have to protect. But first, I want to share with you an announcement. I and the City Council President, together with her colleagues on our City Council, are moving forward with requiring city employees to be vaccinated, starting with a requirement that they report their vaccination status or submit weekly proof of a negative COVID-19 test. No one is immune from the dangers of this virus. As mayor of this city, I've talked to too many widows, too many brothers and sisters, sons and daughters who have lost the people they love the most. And we're seeing an alarming spike in cases among our city workforce, 110 new cases in the past week alone, as compared to 34 in the prior week. This policy is about protecting the health of not just those who provide essential services to keep our city running, but protecting all Angelenos. We're taking this step in close consultation with our labor partners, and will continue to engage our employees, many of whom have reached out to us asking for protections, all who share, I know, a deep concern about the safety of their fellow workers, their families, and the public. In Los Angeles, we are fortunate to have what is probably the most hardworking and dedicated municipal employees anywhere in the world. Women and men who stepped up to challenges, new jobs and new places, who didn't ask whether something we were asking them to do fit into their job description, but who stepped up as heroes throughout this pandemic. They never lost sight of providing those core city services. When I promised your city would never stop working for you, it was those men and women who proved that true. I could not be more proud of our city workers, could not be more grateful for their commitment to public service, or concerned about their health and their well-being. That's what's at the heart of this announcement today, but that we're announcing today require folks to report their vaccination status. So let me turn it over now to our Council President, Nury Martinez, to say a few more things, then I'll come back to share some other important announcements and the numbers for today. Council President Martinez.
Thank you, Mr. Mayor. Angelenos have stayed home for over a year to protect themselves and each other. And quite frankly, I think it's safe to say that we're getting tired of protecting people who don't want to protect themselves or get vaccinated. We have 3 vaccines readily available that are effective. We have vaccine events across our city. We have accessible vaccine centers, and even we've gone door to door offering the vaccine shots. Yet we still have people endangering themselves and others. This is truly a pandemic of the unvaccinated. 99% of the COVID-19 cases, hospitalizations, and deaths we are seeing are among the unvaccinated individuals in LA County. For those of you who are hearing this and have not yet been vaccinated, what is it going to take to get vaccinated? For you to get sick? For you to be hospitalized and put in a ventilator? For maybe a loved one to have died of the virus? What will it take for you to realize that you should have gotten your vaccination? While this vaccine will not 100% guarantee you won't get COVID, it will reduce your chances of you getting the virus, and it absolutely will reduce the severity should you get it. Yes, there are breakthrough cases that occur in vaccinated individuals, but their symptoms and experiences are significantly less severe than those who have been unvaccinated. This past year, you've heard us say over and over again that we're in this together. Well, now it's time for those who are resisting the vaccine to do their part if we're truly in this together. Those resisting the vaccine need to think about the children who are not eligible for the vaccine yet and they can still get sick. And think about those who are not eligible to receive the vaccine. Kids have given up an entire school year. Moms have given up their careers, and some have even lost their jobs this past year. And we're going to continue to take it away from them if you do not do your part. I'm vaccinated, my family is vaccinated, my entire staff is vaccinated. We are doing what we can to help end this pandemic. We are asking you to do your part. Now it's time for those unvaccinated folks to do theirs. I have called for the city's Executive Employee Relations Committee to meet tomorrow to discuss a vaccine mandate for all city employees. How can the city ask Angelenos to get vaccinated if we're not doing it ourselves? Because as a city employee, we need to set the example and we need to hold each other accountable. And by requiring all city employees to be vaccinated, we can help not spread the virus when we are providing neighborhood services and working within our communities. We can also be sure that city employees who are vaccinated are less likely to bring the virus into their homes and to their families. This is necessary. This is a necessary step in returning back to normalcy and lifting the pandemic restrictions. For those who still have questions and concerns about the vaccine, please feel free to ask all your questions. We are now half a year into our vaccination campaign, and we need the unvaccinated Angelenos to stop dragging their feet. As the largest employer in the city of Los Angeles, this is us doing our part. This virus will be with us for a while, but Los Angeles is ready to put the restrictions, the closures, and mass hospitalizations behind us. I'm asking you, get vaccinated today. Do you want to do
We'll do Spanish.
Spanish?
Yeah, we'll do the rest of English. Thank you very much, Council President, and we'll be returning for Spanish, both of us, at the end of English remarks. Thank you for your powerful words. Thank you for your partnership. We're taking this action because the stakes are so high. The more people that are vaccinated, the more we gain the upper hand in this battle. So let me turn to what this battle looks like right now and run through, as I do in each briefing, the numbers. Today we had 2,067 new infections in the county of Los Angeles, 930 in the city. That's 7 times higher than the daily cases reported when we reopened on June 15th. The 7-day positivity rate at our city sites is 10.4%. On June 15th, it was just 1.5%. The positivity rate is going up for all age groups, but it is highest among 18 to 29-year-olds, where it's 13% positive right now. So no matter what your age is or how healthy you are, please understand that you are at risk, and even if you're healthier and younger, you're at risk of spreading that to those folks who are most vulnerable. And you're putting children who are under 12, who are unvaccinated, at risk and not eligible to get the shot yet. Again, this virus is making folks very sick. There are currently 891 people who are hospitalized across LA County, an 8% increase since yesterday, and a 300% increase from June 15th. And of those patients, 195 of them are in the intensive care unit. On Friday, that number was 145. We've seen a 33% increase since Friday. Tragically, more people in hospitals inevitably means in a couple weeks we'll see more deaths. Today, there were 15 new deaths in LA County, 1 here in the city of Los Angeles. We've now lost a cumulative 24,643 souls to COVID-19 countywide. That's 24,643 people who are deeply loved, who are missed every single day. My heart, as always, goes out to every family who still is looking at that empty seat at the dinner table. In the winter, when we faced our last surge, we didn't have a vaccine, but now we do. Now we can prevent people from dying and avoid more heartbreak and loss. Today, over 5.1 million people in LA County, or 62% of our eligible residents, are fully vaccinated. 71% have received at least 1 dose of LA County residents over 16. In the city of LA, it's 67%. And among our most at-risk age group, those who are 65 and older, nearly 89% of them have received at least 1 dose. Thank you to our seniors. And the city now has administered 1.4 million doses of the vaccination directly. This is progress worth celebrating. But in July, we saw a 58% decrease in shots administered at our city sites compared with June. On average, we're administering just 636 doses per day. We would do that in less than an hour at Dodger Stadium at the peak, 3,988 in the last week alone. So we need to see that number ticking up and fast. So if you've not been vaccinated, you're at serious risk not only of getting sick, but infecting loved ones who are vulnerable. When we faced a new extremely contagious variant, we know the difference, or when we face one, we know the difference it makes to act fast. So consider 2 European countries where this variant arrived. It was hit hard by the 4th wave in both the United Kingdom and Portugal. To get ahead of the virus, Portugal took proactive steps with testing, masking, and vaccinations. And as a result, its case rates with Delta are 50% less than in the UK. And deaths are stable in Portugal, but they're doubling every 2 weeks in Britain. Bottom line, as I've said every single briefing, it pays to act fast. Or put differently, as I've said before, when it feels too early, that's the time to act. By the time it feels right, it's too late. So what should we do in the face of this surge of the Delta variant? Just as we have at every step of this pandemic, your city is making decisions that are guided by data and by science, and doing everything possible to make it easier for you to stay healthy and safe, get access to the health care that you need, and to work to increase our vaccination rates. So let's review. First, know your status. Get a test. It's especially critical that you get a COVID test at the first sign of symptoms or if you've been exposed. And if you're fully vaccinated while you're well protected against serious illness and hospitalization and death, you can still get the virus, what's been referred to as breakthrough cases. So as early evidence suggests, you can still pass it along. So first, know your status and get tested. To find a testing location near you, go to covid19.lacounty.gov/testing, or just call 833-540-0473 to schedule a test today. Next, it's important that we double down on everything that we know works. Wash your hands frequently. Everyone, regardless of vaccination status, is now required to wear a mask now in indoor public spaces. And third, if you haven't, please get vaccinated. It couldn't be easier to get the vaccine. We've got plenty of them. Whichever vaccine you prefer, it's free, you don't need insurance, your immigration status is irrelevant, and the vaccine is available at more than 800 sites across LA County, so there's one very close to you. Some of these sites are drive-through, others are walk-up, there's pop-up sites at community events, we're doing shots at branch libraries, a metro station as part of your daily commute, and you don't need an appointment, but if you want to make an appointment or need more information, maybe you're homebound or you need a ride to get the shot, call us at 833-540-0473. Many sites are now open to 8 p.m. to accommodate different work schedules, and you can find a site near you at coronavirus.lacity.org/vaccine. And tomorrow morning, you'll get an alert to your phone with all of that information to make this even easier for all Angelenos. The entire city family is working so hard to save lives and to save livelihoods. And today I thanked our city teams who stood up more than 24 mass shelters and trailers at the beginning of this pandemic as emergency city workers to help our unhoused population. And just as we did by being first with closures, masks, testing with or without symptoms, protecting our senior nursing facilities, reversing the Black mortality gap, providing at-cost N95 masks, and opening up some of the largest vaccination sites in the world, the work we did in those shelters paid off and saved lives. Because of those shelters and our street teams, our unhoused Angelenos, who we were told would be disproportionately vulnerable to dying from COVID-19, have had lower infection rates than Angelenos who are housed. To help our unhoused neighbors stay safe during the surge, and as part of our program to deploy unarmed, trained professionals to connect folks to services called Crisis and Incident Response through Community-Led Engagement, or for short, CIRCLE, the city is launching a new effort the Council President and I are proud to announce that began yesterday, starting in 2 neighborhoods in Venice and Hollywood, and will expand from there. And we're sending outreach teams into the field 7 days a week to provide homeless Angelenos with PPE and hand sanitizer, referrals to services and housing, and to connect them to COVID testing and vaccines in coordination with our mobile units. In the fall, the same program will become part of our therapeutic unarmed response for neighborhoods, or TURN. This is an approach to reimagining public safety, continuing to help and connect unhoused Angelenos to housing and services, but also be trained to respond 24/7 through 911 calls for help with nonviolent incidents with people who are experiencing homelessness and with mental health challenges. For Council President Martinez and me, serving our vulnerable, unhoused neighbors is a top priority, and we're working to provide rental assistance so no one becomes homeless because they can't pay their rent check. And I want to thank the Council President and the City Council for their great work on this. You've been a great champion here. Your leadership was essential to our city launching the largest rental assistance program in the country. And altogether, we've already received, through private donations and 2 rounds of federal funding, $335 million to support renters, to help them pay back their debt, stay housed and recover, and to help landlords pay off their mortgages and meet their needs. Already of that money, $211 million has been distributed or is on its way to households. If you applied in this latest round of rental assistance, you can check the status of your application or sign up to be notified for the next tranche of money that's coming in just a couple months at hcidla.lacity.org. I'm sorry, that's actually hcid.lacity.org. hcid.lacity.org. Also know that local renter protections remain in place. So if you are unable to pay rent due to the pandemic, you cannot be evicted, though you're responsible for that rent, remember. For information and links to free legal services, go to stayhousedla.org, where there's plenty of assistance. This pandemic has been hard on all of us. And of course, it's taken a tremendous toll on our small businesses, which are the lifeblood of our neighborhoods and our city. Across Los Angeles, businesses have laid off workers, they've scaled down, and too many have shut their operations altogether. Many others have managed to ride out this storm, often with support from the city, and I'm so proud that visiting across the city the last 2 weeks, I've talked to businesses that said those critical lifelines from the city helped them stay alive and open. More than $55 million in direct assistance and grants to help small businesses. I talked to business owners across the city who said these dollars and policies that we enacted were the difference between whether they could stay alive and not. I dined al fresco in Little Tokyo with business owners who said that outdoor dining was literally a lifeline for their businesses during the pandemic. I met with folks in Hollywood who immigrated here and set up a shop that became essential to their neighborhood. I dropped into a restaurant in Boyle Heights, a boutique in Melrose, a cafe in Koreatown. And it wasn't just city funds that kept these places afloat. It was you. And so I encourage you, go back to those businesses. They need you now. And every dollar you spend locally with a locally owned business, 70 cents of that dollars stays here, and it gets recycled. We know that our business owners are resilient, and I have been so impressed at every stop of the way of the resilience of our business owners and workers I've met. I've been encouraged by their dreams to not just come back, but to come back better. And they're determined, and we're determined to double down on our support. Whether it's extending LA Al Fresco throughout the summer and working together with the council to make it permanent, or the expansion of LA Optimized, which is a program for free to help small businesses with digital tools to grow your bottom line. We are here to help. And in fact, we have an LA Optimized Accelerator Academy right now, a free webinar for LA businesses that takes place the first Tuesday of every month. The next one on August 3rd will focus on helping your business with digital accounting and payments and business automation. So to learn more, go to LA City Optimized. That's lacityoptimized.org. We need our businesses to stay healthy. And so in the fall, the council and I will be putting $50 million out for LA City businesses. $25 million for restaurants and small businesses, and another $25 million for businesses in our hardest hit communities in the form of grants, technical support, and we'll share that information in coming weeks so that you can get ready to apply and get those dollars in the fall. Bottom line, we've helped in the summer, we helped in the spring, we helped last year, and we're not going to abandon you because we know it takes time to get back on your feet. The Department of Public Health has not issued an order from the county to shut down any businesses at this time. But another thing we can do to help, because LA County's high case rate right now would land us in the red restrictive tier if we were still using the state's blueprint for a safer economy system, is for us to all abide by those orders. Wearing a mask indoors in those businesses and public places, be thoughtful and cautious in the weeks and months ahead. Look, I know we would all love to be done with masking. It's like seeing an old friend we didn't want to see, but we need to do it. This contagious virus and this moment is real. I see it in my city workforce. I see it with friends. We all know this. We're seeing that, and people are arriving in hospitals. It's not a form of punishment. It is a form of protection. It's an act of love to wear. And this was never going to be easy. I think we all thought the vaccine's here, yippee, it's over. It's not yet over, but it will be over with your work. And I have a special message, and I want to build on what the council president said. Let's do this for our children this fall. We can't afford to have our schools not reopen. We should be bringing these cases down so that we can ensure that our young people, our sons and daughters who are so disconnected from friends and from learning and from life, can return to our schools. That's why we do it, because it's critical for them moving forward. I know how excited my daughter is to be with friends and teachers after such a long time of staring at a screen. And I also recognize there's families that are fearful. They're anxious about returning to school. And I appreciate how difficult this work is. I don't come and talk to you when it's easy. I come to you when it's tough. But our rec and park centers, our cultural affairs sites, Our family source centers, our libraries, our LA Best programs, our district and our city are here for our families and our children. And we're going to continue to grow and expand these supportive services to give you the confidence, not only in the health of our city, but in the opportunities for your children. But it's a group effort, a goal that we all need to be engaged in reaching to the safe return to school for our kids. In close, this is a surge. It's not the worst surge that we've had, but you can ensure that it doesn't become the worst surge that we've seen. Let's work together to stop community transmission in its tracks. This virus has evolved. It gets smarter and faster and more dangerous. But we have new weapons, like the vaccine, that can meet that threat. And I know we can do this. I know it's difficult. I know how much we all wish that COVID would never have come or would just disappear forever in the snap of a finger. But I also know we're going to get through this because I've seen you. I've seen you do the right thing. I've seen your generous hearts. I've seen your steely determination. I've seen your brilliant work. We're Los Angeles. We lead with love, we lead with hard work, and never bet against us. So thank you for what you will do, and as always, sending you strength and love. I'm happy to answer some questions. Robert Kovacic is here as our pool reporter today, and then we'll come back and give some Spanish remarks too. Thank you. Robert?
Good evening, Mayor. Good evening, Council President.
Good evening.
We have a number of questions for you from my colleagues. I would like to start, though, by we're talking about, I'm quoting here, a surge. Do you foresee restrictions, closures, or going back to where we were in our future?
I think we can avoid it. I think we can avoid the closures that we saw of the past, but it won't happen automatically. That's my main message tonight, is we have to all participate in making sure that doesn't happen. Is that risk possible? Absolutely. If we get overwhelmed in our hospitals again, if we see people dying, I've been to too many funerals. I've talked to too many people on phones. I've lost members of my own family. This is not something to just be pissed off about. This is something for us to collectively do. And if we do it right, Robert, no, I don't think that we will have to close those places down ever again. And for our businesses who are just hanging on, let's make sure that we don't. All right.
We pretty much said it all.
Okay. All right, I'll bring in some stuff.
I'd like to start with a question from Emily Alpert Reyes with the Los Angeles Times. You're going to want to take notes here because it's multi-tiered.
Okay.
But she covers a lot of what we're all wondering about the vaccine mandate. We'll start with Emily asks, what is the timetable for employees to provide proof of their vaccination status to the city? If that is not determined at this point, when are city departments expected to have gathered this information, and when would testing begin? Mm-hmm. She goes on to ask, would eliminating the option of weekly testing rather than vaccination hinge on the FDA granting full approval for all 3 COVID-19 vaccines that currently have emergency authorization, or would it potentially kick into effect as soon as any one of those vaccines have full approval? And finally, can this plan be vetoed by city employee unions? What requirement, if any, is there for the city to consult with them on this plan? And if so, which aspects of the plan does it need to confer with labor groups on?
Well, Council President, I will do our best law professor answers here. First and foremost, we're asking department heads to collect data on vaccination rates, submit those by August 15th. I've looked at every place that is requiring this, and nobody yet has a date, because it requires us to take probably a couple weeks to make sure we have the testing infrastructure for employees that get tested, and to make sure people aren't returning to work this month yet. I think most places we're looking at after Labor Day, which will have to be revisited depending on the caseload. But we are looking at some weeks. We don't have a set date. Second, the case law seems to be that this can be mandated, but under emergency use, you cannot. So we'll have to cross that bridge when it comes, and I don't worry that Los Angeles needs to do that case law. We're going to see that across the United States in different universities. I know in Indiana there's a case right now. So far the judge has upheld that, in order to create a safe university environment, that is an acceptable thing to say if you're going to come here to work or to study. Third is there's an obligation to meet and consult, but not to meet and confer. For those of you who don't know labor law, as nuanced as we've had to learn it, that means, yes, we have to talk with our labor unions, but we can take this action. There's no veto there. But like I said, we want to do this hand in hand. I appreciate that our labor partners have been probably our strongest advocates in saying, please get vaccinated. They may have some voices who say, don't put a mandate in, but I think that we feel very strongly that we need to put this to rest. We need to get out of this, and we have to set the example as one of the largest employers here in LA County. Let me turn it over to the council president.
I think I can answer the timeline question Emily had. I think that's one of the items that's up for discussion in tomorrow's EERC meeting in terms of what it's going to take for us to ramp up testing for our employees and the data that needs to be collected and the timeline in which we're going to put all this into effect. So that's what we hope to be able to have a robust conversation about all this in committee tomorrow and come up with a recommendation for the council moving forward. And in terms of the unions, all I want to say about that is I think it's really all up to us to really step up. I think everyone needs to step up collectively and recognize that we cannot be headed in this direction. I can't even foresee myself not sending my child to school next fall. It was an absolute nightmare this past year, not only for her mentally, but academically, and I cannot even imagine what a parent who does not understand the system or the technology to work with their child, what they've gone through over the past year. We cannot go backwards. And so I think we're going to do everything in our power to move forward and work with our labor partners, but it's really up to everyone to begin to step up and do the right thing.
One last thing, Robert. I think there's one other question Emily put in there about once emergency use is done. We'll have to have some people who can be tested no matter what because there's ADA accommodations. Some people can't get vaccinated. And in the past, there's case law around religious exemptions too. So for folks who absolutely can't, we want to make sure that they're not contagious and bringing that to the workplace because that can kill a coworker, can kill a coworker's family member, and we want to protect them.
Is this mandate very similar, or is it a carbon copy of what we saw in New York City and San Francisco as well?
I haven't read theirs. We're writing our own here, but I think it's similar. I think you're seeing this is not just something that people are doing to be politically correct. They're not just doing it because another city is. We've been talking about this, the council president and I, other council members. We've been on the same page for a number of weeks. This is the time now to make sure that we put a plan in place, that we do that, and we encourage people, that last piece, especially when we look at who's vulnerable. Right now, it is a pandemic among the unvaccinated, as the council president has said, as Dr. Ferrer has said, and we want to save those lives.
Jackie Fortier of KPCC asks, who will provide the tests that unvaccinated employees will need to take? If they are expected to travel to a city or a county testing site, will they do that during their work time?
That's a very legitimate question. That's one of the ones that we're going to tackle tomorrow at the ERC meeting. I chair ERC, the council president serves on that with 4 of her colleagues, so we have both council and mayor on that. I personally want to make it as easy as possible for city employees. This is not some sort of punishment. We need to make those accommodations, especially for folks who cannot get vaccinated. And I think we've shown our ability as a city. We've done, we think, more tests directly than any government entity in the United States besides the national government. While you've had states that funded, we actually ran those centers, and we probably did the most of any government entity, state, local, in the United States. So we've got a lot of experience. We'll make it easy, we'll make it convenient, and we'll make sure that everybody can either get their vaccine or make sure they tell us what their status is. Yeah.
This is from my colleague over at Cavea Telemundo 52, Gabriel Huerta. Will the city implement disciplinary measures or salary reductions for those workers who do not present proof of vaccination or a negative COVID test? Gabby asked you to answer this in Spanish as well, please, but I know we're doing that as well.
I'll start in Spanish. No es necesario a este punto, pero tenemos una reunión del comité de nuestros empleados ejecutivos mañana. Es importante tener información por toda la gente, pero nuestra meta no es a dar un daño a nuestros empleados. La meta es obtener su estatus de la vacuna o la vacunación por la gente. And in English, what I said is it's not our goal to punish people. I want to be very clear, to fire people, to reduce their salary. It's to get them vaccinated, or if they can't be vaccinated, to make sure they're not infecting other people, full stop.
Bueno, en español, la meta es de que les inculquemos a nuestros las personas que trabajan para la ciudad que por favor se vacunen lo más pronto posible. No nomás es importante porque salimos a servir la comunidad, pero también es un modo de protegerse a sí mismo para que no lleven el virus a sus casas y a sus familias. Es una meta para poder crear más información. Si tienen preguntas sobre la vacuna, cuáles son los riesgos, pregunten, infórmense, hagan lo necesario para poder protegerse a ustedes y a sí mismos. Y mañana en el comité vamos a estar debatiendo la mayoría de la pregunta que preguntó sobre el salario, sobre si estas personas van a poder vacunarse durante el trabajo y si vamos a proveer el examen al COVID-19 durante el trabajo también.
Claudia Pescuda with KNX asks, given that the CDC says emerging science indicates some vaccinated people can be contagious if they're infected with the Delta. With that said, do you think we should be regularly testing all city workers, especially those who come into contact with the public?
So the contagiousness is different than whether you can get it. There is some research saying potentially. Right now, CDC's guidance is if you're vaccinated, just to look out for symptoms. They don't recommend yet being away from work, et cetera. But I want to look at that science very carefully. If it is that, that's certainly something that I'd love to provide. If we stand up testing for our employees to know status, even for those that are vaccinated, I think that's very important. I've seen the impact of that here, where we've had departments or other places where one person comes down with Delta and suddenly 3 or 4 people are out of work again. Like I said, this week it was 164, I think, city employees. And last week it was 34 employees, or I might be off by 1 or 2 there. But we've seen a huge increase just in 1 week. So absolutely, I would be open to that. Another point I want to just briefly make too is our goal is not just to sit up here and get angrier and angrier and tell people, you must get vaccinated. I respect that there's a lot of conversations that have to happen. For some of us, it's a very easy decision. For others, it's a very emotional thing. It doesn't mean they're anti-vaccination, but it requires kind of a careful conversation, like Council President was saying, with the facts. And I'm committed to doubling down, department by department, those conversations with employees, to not just leave them by themselves, not to just condescend to them like we know everything better. Some people don't like government always telling them what to do, even if they work for government. We have to engage and meet people where they are, but I think we also have to be strong and say, the facts are this, now let's move forward. And these kind of folks that have not gotten around to it yet, who we can win, we've got to get them vaccinated as soon as possible.
Claudia follows up, and
I was hoping Claudia would have at least a second.
of course, she's got many, don't worry, as Claudia will always do. She follows up, and we had this conversation last night with NBC4, with the Los Angeles Police Protective League. We have our first responders, and only about half of them, certainly within the LAPD workforce, are fully vaccinated. Claudia wonders your thoughts about the low vaccination rates among police officers and firefighters, and let's talk about what we hope this can accomplish.
I hope that we save more police officers and firefighters' lives, because unfortunately, we've had to bury some this year. And maybe the council president wants to share the story that we talked about, but I know that in her district, and I went to that funeral, I think there's family members of these firefighters and these police officers, I know there are, who I've talked to, who say, please get vaccinated. If you think it won't kill you, it can, and if it won't kill you, it can kill somebody that you love.
Yeah, as I was mentioning to the mayor prior to the press conference, we both know way too many police officers who've passed away, contracted COVID, whose families have been infected as well. So I would hope that we can continue to encourage them and to help us lead the way in terms of setting the example for the rest of the city. We cannot stand up here and ask Angelenos to get vaccinated. I cannot continue to go back to my community when firefighters and police officers haven't done the same thing. So they're at risk more than anyone else. They're first responders. We've seen the infection rates among these two departments, and I would hope that by looking at the hospitalization rates and the direction that we're headed, that they can step up and do the right thing and talk to one another and inform each other of the importance of getting vaccinated. That's what I hope we get out of this, but we have to set the example. We cannot hold the rest of our city accountable if we're not setting the example and holding ourselves accountable. This is what this is about. And so I hope that this mandate would definitely put us in the right direction and set the example for the rest of the city so that other Angelinos have faith and get vaccinated.
Council President, you talked about that there would be at this point no disciplinary action against City of LA employees. If a City of employee takes a COVID test and the COVID test comes back positive, what then are the ramifications for that employee?
I don't know yet. And these are the questions that the mayor alluded to earlier today in terms of the difficulty about all this and what kinds of, the debate that's going to happen tomorrow in committee. I think these are all questions, they're all really good questions. I don't have the answers to them because I simply don't know what the rest of the committee is going to agree to, but I'd be open to all suggestions, and I'd be open to seriously looking at how we can get our folks to get vaccinated. And not only, I don't want to threaten anyone, but I certainly want to be able to make it very clear that this is a direction that we all have to be headed in. Mayor, I don't know if you want to add to that, but you want to add the nice part to this?
No, look, no,
You're the nice
I'm
guy.
actually going to be the opposite. If you're positive, you better go home, and you're not working. That's the consequence. You're not staying here. You're not working, and I hope for some, because first of all, you're part of this family, the city family. We're going to pray for you. We're going to make sure that you get well. We'll do everything we can, and we hope that experience arms you with knowing that you now have something that prevent that from happening again or to anybody else. But we shouldn't be putting each other at risk.
Did the City of LA ever think of taking it to a more stricter level, like the Department of Veterans Affairs that are taking the weekly COVID tests out of the mix and saying, no, you have to be vaccinated within the next 2 months?
We'll take this step first, but I would say there's nothing off the table. And I think as a country, there's a lot of governments simultaneously looking at this. And not just governments, I have a lot of employers who've come to me saying, can I please mandate this? And I'm not a lawyer, so I tell them, look at the case law, do whatever you want, but I know it's holding back companies, it's holding back our economic prosperity, it's taking lives, and it's slowing down our recovery. Was this the most miserable year of our lives? Yes. You want to know when the answer is to stop it being miserable? Is to stop the spread. And what stops the spread is vaccinations.
Mayor and Council President, as we wrap up this part of the questions, from Dakota Smith, LA Times, she goes back to the testing apparatus for city employees to take these weekly tests, and are taxpayers going to be expected to pay for this apparatus? And if not, who will be paid?
We'll answer those questions, but we have health insurance for our employees, of course. I mean, that's part of protecting our workforce. And I think this is something all employers are struggling with and looking at, but that should be something that right now you can get tests under the healthcare plans we have, so it shouldn't cost the public anything more.
Turning to a question that is repeated by a few of my colleagues, but we'll address this one from Alexis Olivier Ray with LA Taco. This concerns our homeless. Yeah. Despite the recent surge in COVID-19 cases, the city of Los Angeles has decided to remove hundreds of portable sinks and toilets from homeless encampments recently. At least 2 council members have said they do not support this. Why would the city remove hygiene stations when cases are surging? And what are the concrete plans that you have in place to offer hygiene services to encampments now going forward?
So we're actually doubling down in areas where people use these more. It's a set amount of money. We spread it out very thin before. I drove by, a couple completely empty toilets in a median where there wasn't a tent anywhere in sight. And that's just a waste of taxpayer money. So we're trying to be more effective and more impactful. We have people that we're paying for 24/7 to have people there when 1 or 2 people are using that as their toilet, where we could take that same money. So I want to be clear, we're not cutting any money from this. If anything, we've added a little bit, but we're going to spend it in places that are much more impactful. And any council office that wants to keep them there, that's something certainly, I'm sure the council president can speak to that more, but we're adding more funding to our pit stop program, where people get showers, hygiene, and other things that are just as important for the spread, more important arguably than just where they go to the bathroom, mobile hygiene services, showers, and restrooms. So the pit stop programs will expand and take that money in places where we've had some successes in either moving people or those areas have thinned out considerably.
Yeah, I don't disagree. I think I know who the 2 council members you're speaking about in terms of the removal of hygiene stations and restrooms. But I also have to convey that we cannot normalize people living in encampments. That to me is completely unacceptable. And so we have got to encourage the building of homeless shelters, and housing has to be the priority, and getting people off the street as soon as possible needs to be the mandate of the day. Encouraging people to remain on the streets and normalizing this way of living and allowing people to die is not something that I will ever accept.
As we wrap up, we'll just leave it to you. I'm just curious that, here we are, Council President and Mayor Garcetti, once again, after coming so far to put this pandemic behind us. And it seems, to quote an emergency worker in one local hospital, we are moving backwards. On a personal note, I'm just curious, your thoughts on where we are with the pandemic currently in Los Angeles.
I would summarize this moment this way, and I'll speak to everybody still watching, at least 6 of you who I think are still tuned in. We've come so far, and we are. Look down the mountain. We're not quite at the peak, but we are way up that mountain. And even if we slip down a couple feet, we have the power to get to that summit. We have the ability to finally complete this climb. I know for all of us it's frustrating, but I think a lot of people thought this would be easy. But something as vicious as this, that's killed our family members, that's shut down and killed off our businesses, that has taken millions upon millions upon millions of lives around the globe. This wasn't going to be an easy finish, but it will be a strong finish. And I have that confidence that we can get there. Think about how far we've come just in the last 4 months. I haven't spoken to you in nearly 4 months, which is a reflection of the strength that we have. I'll come here as a backstop when there's something important to say, when it's a moment that I need you to summon a little bit more strength. Then the rest is on you. It's never been on government by itself. We don't have the power to do that, but Los Angeles and Angelenos do. So don't get discouraged. Putting a mask on is a small price to pay for saving a life and ending this thing. That should be our goal. We know how to do it. Let's get it done.
Well, for myself, just on a personal level, I am frustrated and just exhausted. I'm exhausted of having to explain to people the importance of vaccinations. I'm exhausted about arguing about the importance of wearing a mask to protect yourself and other folks around you. And this year has not only been frustrating, but honestly, it's just been frustrating and exhausting, not only for me, but for my family, for everyone who works with me, trying to keep our city moving forward. I can't even imagine what a hospital worker must feel like right now. I almost feel like we've let them down because they have not had a break in over a year. And we're not giving them a break because we continue to fight over masks. We continue to debate over the importance of getting vaccinated. And yet you'll see an outrage of people the minute we have to start to shut businesses down. You'll see people on the streets protesting because we've had to shut down restaurants one more time. I remember those days. That happened I was about 7 months ago when we had those debates where people were outraged because we had to shut down outdoor dining because the pandemic was so horrible and the surge was so bad leading into Thanksgiving and Christmas. I don't want to think that we're heading in that direction, but I often think what else needs to happen before we finally get the picture here that we've got to get vaccinated, we've got to protect ourselves and each other, because I don't want to see those days come back again. And it's honestly, it takes a toll on yourself. I don't know about the mayor, I know we've talked about that before, but it's been an incredibly exhausting and frustrating year, and we've got to get it together.
For sure. Thank you. We'll now give some remarks in Spanish as well. As always, thank you to our sign language interpreters. Channel 35, who provides this link, won an Emmy Award for all this. Congratulations for your great coverage in informing the people of Los Angeles, and to our press corps, as always, for being there. Muy buenas tardes, Los Ángeles. Me dirijo a ustedes por primera vez en meses, porque estamos enfrentando una nueva oleada de casos de COVID-19 en Los Ángeles. La variante Delta se ha sentido como un caso en nuestra ciudad y es altamente contagiosa. Se está propagando aproximadamente 2 veces más fácilmente que el virus original y ahora representa más del 80% de los casos en el condado de Los Ángeles. El número de casos es más bajo ahora que cuando tuvimos la oleada de invierno, pero el viernes tuvimos más de 3,000 casos en el condado de Los Ángeles. ¿Cuándo fue la última vez que esto se sucedió? Febrero. En solo un mes hemos visto que nuestros casos totales se han más que triplicado con respecto a junio. Este aumento no solo está ocurriendo aquí. Nuestro país ha visto un aumento de 4 veces en nuestros casos por día durante el último mes. La buena noticia es que ahora tenemos una vacuna y es segura y efectiva. Es nuestra herramienta más poderosa para poder luchar contra el virus. Es por eso que estoy requiriendo que nuestros empleados de la ciudad sean vacunados. Comenzando con el requisito de reportar su estado de vacunación contra COVID-19 o presentar una prueba semanal negativa de COVID-19. Estamos dando este paso para proteger la salud no solo de aquellos que brindan servicios esenciales que mantienen a nuestra ciudad en funcionamiento, sino de todos los angelinos que servimos. Aquí en Los Ángeles tenemos la suerte de tener lo que estoy segura en la fuerza laboral más trabajadora y dedicada en cualquier lugar. Mujeres y hombres quienes han intensificado sus esfuerzos durante el año más duro de nuestras vidas, sin perder de vista su misión de proveer servicios increíbles para hacer nuestra ciudad más fuerte, segura y equitativa. No podría estar más orgulloso de nuestros empleados de la ciudad, agradecido por su compromiso hacia el servicio público y preocupado por su salud y bienestar. Porque cualquier persona que no esté vacunada está en riesgo de enfermarse y de contraer una enfermedad grave contra la que estarás protegido si recibes la inyección. Para mantenerse sano y prevenir la propagación del virus, es fundamental que se haga la prueba de COVID a primeras señales de los síntomas o si ha estado expuesto. Puede encontrar sitios de prueba de COVID yendo a covid19.lacounty.gov/testing. Es importante que nos enfoquemos en lo que sabemos que funciona para detener la propagación. Tenemos que ser vigilantes, lavarnos las manos frecuentemente y todos, a pesar de su estado de vacunación, deben usar mascarillas en espacios interiores públicos. Y si todavía no lo han hecho, prepárese para ponerse la vacuna. Es gratis, no se necesita seguro de salud y la vacuna está disponible en más de 800 sitios en todo el condado de Los Ángeles. Su estatus migratorio no es importante. Muchos de estos sitios están abiertos hasta las 8 de la tarde para recibir la vacuna. Puede encontrar un sitio cercano a usted yendo a coronavirus.lacity.org/get-vaccinated. Mañana temprano recibirá una alerta a su teléfono con esta información. Estamos trabajando duro para proveer asistencia de alquiler para que nadie pierda su hogar, porque no pueden pagar ese cheque mensual. Mientras que todavía estamos esperando fondos del American Rescue Plan, trabajaremos para obtener fondos para inquilinos y propietarios rápidamente. Si usted aplicó para la segunda ronda de asistencia para inquilinos, puede revisar el estado de su solicitud o regístrese para recibir una notificación si se reabre la solicitud del programa de asistencia para inquilinos yendo a hcid.lacity.org. Reconocemos que algunas familias están enfrentando temor y ansiedad sobre el regreso de sus hijos a la escuela. Reconozco que esto es muy difícil y quiero que sepan que su ciudad y distrito escolar están aquí para ustedes. Nuestros parques y centros recreativos, los sitios de asuntos culturales, nuestros centros de recursos para familias, nuestras bibliotecas y programas LA's Best, han servido a familias cada día durante la pandemia. Y continuaremos aumentando y expandiendo estos servicios. Estaremos aquí para ustedes y haremos todo lo posible para mantener a sus hijos y todos en la ciudad seguras y saludables. Nosotros saldremos de esto, porque sé quiénes somos y como angelinos somos capaces de hacerlo. Gracias a la ciudad, fuerza y amor de Los Ángeles. Y ahora los dejo con la presidenta del Consejo Municipal, Nury Martinez, quien hablará más sobre lo que estamos haciendo para mantener a nuestra fuerza laboral de la ciudad segura y saludable, una campeona en esta lucha contra COVID-19. Nury.
Gracias, alcalde. Los angelinos han quedado en casa por más de un año para protegerse uno al otro. Francamente, yo pienso que se puede decir que estamos cansados de proteger a personas que no se quieren proteger a sí mismas y vacunarse. Tenemos 3 vacunas disponibles de inmediato que son eficaces. Tenemos eventos de vacunación en toda la ciudad. Tenemos centros de vacunas accesibles y hasta estamos yendo puerta por puerta ofreciendo la vacuna. Más del 19% de los casos de COVID-19, hospitalizaciones y muertes que estamos viviendo entre individuos que no se han vacunado en el condado de Los Ángeles. Para los que me están escuchando, que no se han vacunado, ¿qué hace falta para que se vacunen? Que se enfermen, quieren ser hospitalizados o conectados al respirador, quizás la muerte de un ser querido por el virus. ¿Qué hace falta para convencerlos de la importancia de vacunarse? Aunque esta vacuna no garantiza que usted no sea contagiado con COVID-19, puede disminuir la posibilidad de contagiarse y absolutamente disminuir la gravedad de sus síntomas si usted es contagiado. Los que se oponen a la vacuna deben de pensar en los niños que aún no son elegibles para la vacuna y se pueden enfermar, las personas que no son elegibles para la vacuna. Yo estoy vacunada, mi familia está vacunada y mi oficina entera está vacunada. Estamos haciendo todo lo posible para acabar con esta pandemia. Estamos haciendo lo que nos toca a nosotros y poner de nuestra parte. Ahora es tiempo que las personas que no han sido vacunadas hagan de su parte. Llamé al Comité Directivo Municipal de Relaciones Personal a una junta para hablar sobre el mandato de vacunar a las personas que trabajan para la ciudad de Los Ángeles. Porque como empleados de la ciudad necesitamos dar ejemplo, necesitamos rendir cuentas entre nosotros. Con ese hecho de rendir a todos los empleados de la ciudad la vacuna, podemos evitar propagación del virus cuando estamos dando servicios en las vecindades y trabajando con la comunidad. También podemos asegurarnos que los empleados de la ciudad que son vacunados tengan menores probabilidad de llevar este virus a su familia cuando lleguen a casa. Este es un paso necesario para regresar a la normalidad y y quitar las restricciones de la pandemia. Los que tengan preguntas o preocupaciones, con confianza pregunten. Ya llevamos mitad de este año con la campaña de vacunación y necesitamos que los angelinos que no sean vacunados hagan y pongan de su parte también. Como el empleador más grande de la ciudad de Los Ángeles, esto es cumplir con nuestro compromiso y hacer de nuestra parte. Este virus permanecerá con nosotros por un tiempo, pero la ciudad de Los Ángeles está lista para dejar en el pasado las restricciones, los cierres y la cantidad de personas que están hospitalizadas y se han muerto. Hay que poner eso en el pasado. Por favor, vacúnense hoy. Gracias.
Thank you all very much. We'll hopefully not see you soon at another briefing. Thank you all so much. Take care.